call the member for Penrith.
Thank you, Mr Speaker. In this job and the very lucky privilege we have of representing our constituents across the state, we come across many fantastic groups and organisations and wonderful people, and I wanted to highlight before the House one of those groups from my electorate, and that's actually the Nepean Hospital's Neonatal Intensive Care Unit, and congratulate them on reaching their 25th anniversary this year. The Nepean Hospital NICU is one of the most active units in Australia, and the staff do an outstanding amount of work on behalf of young families in our community and far beyond. Approximately 10% of the admissions to the NICU are born in under 30 weeks gestation, some born as early as 24 weeks. Thankfully, in the past 25 years, neonatal medicine has improved significantly, and mortality rates and health outcomes for premature babies have improved as a result. Since opening with one intensive care cot in 1991, Nepean Hospital's NICU has cared for over 10,000 babies, some weighing as little as 400 grams. When one of those little hands wraps around your little finger, you truly know how special this place can really be. In the last 5 years, the unit has averaged over 1,000 admissions a year. In fact, in 2015, the NICU had 1,085 admissions, a 5.8% increase from the last year. I was delighted to join my colleague, the member from Algoa, Tanya Davies, recently at unveiling the 12th cot, a $1.36 million intensive cot, adding to this wonderful unit. I'd like to thank and acknowledge the Health Minister, Gillian Skinner, for her ongoing and continued support and commitment to the NIC unit, and particularly the allocation of funding for this 12th cot. There are now 37 cots in total across the NIC unit, 12 of them designed and specialising in the intensive care for the sickest and earliest of our newborns. The new cot will allow for more babies to receive the highest quality care and life-saving care in those challenging first weeks and months of life. The state-of-the-art technology, coupled with the highly skilled and compassionate staff who work at the Nepean Hospital NICU, allow families to feel supported at this immense time of stress. I was also able to meet Rebecca Ellen, the first baby born at the Nepean Hospital NICU unit in 1991. Rebecca spent 5 months in the NICU at 28 weeks after being born at 28 weeks. Quite an amazing story, and she's a genuine fighter. Only last year she had a double lung transplant. She's an amazing woman and just shows how good the quality of care is that exists across our health system. The staff and families at Nepean Hospital NICU only know too well that these cots can make a massive difference to life. I've also wanted to recognise the work that's done by the Nepean Neonatal Intensive Care Parental Support Unit, or what's often referred to NICUPS, and recognise Deanna Gibbons for her outstanding work as well. NICUPS was formed in 1992, an initiative of Julie Clark, a mother of a 27-week premature baby who was born in England. Julie had formed a similar group, and upon moving to Australia, she decided to establish the concept here. The group is based at the hospital, and its membership is made up of parents of babies who have been cared for at Nepean's NICU. Their aim is to support parents before and after the birth of their baby and assist in providing emotional support during the baby's stay at the NICU. The Nepean Hospital, or the NICUPS as we like to call them, is an outstanding example of selfless spirit that really binds the Penrith community together. The NIC unit at Nepean Hospital is one of those organisations, if I could call it that is made up of dedication, professionalism, an unwavering spirit that is making everyone in Penrith incredibly proud. I also wanted to recognise Lynn Down, who is currently the Director of Children's Health at Nepean Hospital, for her long-term commitment to the NIC unit. She's been there from the very first day. She was the first doctor on the ward in 1991, and she was there when Rebecca was born, and she's still working at Nepean Hospital to make sure that young children across our community, not just in Penrith but as far west as Dubbo, as far south as Griffith, get an opportunity to have a great start to life. And I know Lynn would make sure that when I was speaking today that it wasn't just about her, but also recognise the dedication of the countless amount of nursing and support staff and other doctors that have worked across this amazing unit over the last 25 years. They've brought 10,000 babies into the world. They've made the start to life a successful one for so many families and so many young babies, and may the next 25 years be as successful as the last.